Now, I am very delighted to invite Mr.Jamin Chauhan, Assistant Professor, Manikaka Topawala Institute of Nursing, Charosat University, to present a very informative lecture on therapeutic communication skills in mental health. He is pursuing PhD in Assertive Communication at Charosat University. He has done MSc Nursing in Mental Health from Symbiosis University and BSc Nursing from Bharati Vidyapeeth University. He is an expert in counseling, training and placement. He has very innovative pedagogical approaches and has more than 10 years of experience in teaching field. Sir, I would like to request the commencement of lecture.
Before they handle the technical functions, I would like to thank the audience for sitting very decently and quietly throughout the two lectures. In fact, the lectures were very interesting and they have made me very conscious, because both the eminent speakers were from the clinical side. And I, being an academician, the perception is that these academicians teach from the book. They are not clinically oriented. So I try to make my lecture as practical as possible. Bear with me for the next half an hour, and if I extend my time, please don't hesitate to communicate to me non-verbally that I have overshot my time. Yeah, thank you for the very glamorous introduction. It is not as glamorous as it sounds. I am here to teach, or rather communicate, a topic which gets thrown around in nursing very frequently. As soon as you enter nursing, the first year of BSc Nursing or even GNM, fundamentals of nursing, the first topic you are taught is on communication. And even in the fourth year of BSc Nursing, when you are taught say nursing management or nursing education, you are taught about communication. And in between, say subjects like mental health nursing or community health nursing, it all has communication in it. So it's difficult to teach you something new, and I'll try to make it as new, as interesting as possible for you. I'll try to minimize my teaching and rather teach it as a story. So yeah, please bear with me for the next half an hour again. That's right. So what I'm going to discourse to you today is mainly about therapeutic communication. As I said, communication is a topic which gets thrown around very frequently. This is another aspect of communication, which is therapeutic communication. Now, if you see the types of communication, there are verbal communications, there are non-verbal communications, there is assertive communication, there is passive-aggressive communication, there is aggressive communication. What I'm going to talk about today is therapeutic communication, and I'll also tell you why therapeutic communication, why are we learning therapeutic communication now, and I will also try to give you an insight into the skills needed for therapeutic communication. And at the end of the lecture, I will also, if time permits, I will also let you know what are the don'ts of therapeutic communication. So let me move ahead to what is communication. Anyone who is aware of yesterday's headline? Yesterday's, not today's. Yesterday's headline, anyone? Most newspapers had dedicated the headline to one particular news. Sorry? Can you be louder? Yesterday. I'm talking about yesterday. Gukesh was champion, I think, 4 days back. Yeah, yesterday's headline was on Alu Arjun. He getting arrested at night and not getting a bail. Communication. Yeah. Newspapers are supposed to be, even today, in the day of digitalization, even today are said to be the best mass communicators. We as nurses are supposed to be the best one-to-one communicators. Right? So this topic has further importance for us. Now, communication, the definition is nothing new. It is a give and take of information. Right? Me giving information and probably you taking information at the moment. But if we talk about therapeutic communication, how is it different? The difference lies in the fact that it is between a nurse and a patient, essentially. So we have two important aspects here in this definition. That would be great. Okay. So if we talk about the definition of of therapeutic communication, there are two main aspects that we have to look at. First and foremost, it is between the nurse and the patient, right? It is mainly one-on-one, usually one-on-one. So it is between the nurse and the patient. Secondly, it focuses on the specific needs of the patient. As Sarmishka Madam very rightly said that in most of the elevators of hospitals, there is all sorts of gossips that take place. That is not therapeutic communication, though it takes place in the hospital. So therefore, when we talk about therapeutic communication, it should highlight or it should focus on the specific needs of the patient. Say for example, history taking in psychiatry, it's a method of therapeutic communication. Say for example, mental status examination, it is a way of therapeutic communication. Right? So these are things which focus on the patient, and we are supposed to use that as a method. The next slide, it gets a bit boring from here on. Again, please bear with me. The left side of the screen focuses on the different techniques of therapeutic communication. On the right side, I have tried to put in examples, real life examples of where we can use this particular technique. The first and foremost technique that most of us are not good at is listening. Right? Even as nurses, we tend to speak a lot to the patient. Yeah, you have to do that. You take your medications on time. I'm going to give you Foley's care. You know, your intracath is out. I'm going to put a new intracath. Most of the time we are talking. Most of the time we are laughing, is it? Yeah. So we are talking most of the time, and that is what is not needed in therapeutic communication. What is needed as a primary skill is listening. Listening does not mean passive listening. In fact, it should be active listening, as in nodding your head, saying after the answers. So these are things, these are small cues that should be used while you communicate therapeutically, especially listening to the patient. Broad opening, as the name suggests, it involves a questioning technique which can prompt an open-ended answer. So probably a question like, Mr. Rahul, what would you like to talk today about? That's an open-ended question. Right? So it prompts an open-ended, elaborate answer from the patient. So that is what is broad opening. We're trying to broadly open the patient. We're trying to ventilate feelings from the patient. We are trying to ventilate information from the patient. Restating. Again, a very important aspect, just to drive home the point, to pinpoint the point. I'll give an example, as in the client or the patient here says, I cannot find words to express my feelings, which is a very common sentence among mentally ill patients. Therein the nurse says, I understand that. You find it difficulty in ventilating your feelings. Let me try something else. Let me try to use another language, right? A language more comfortable for you. So that is what is restating. You try to relate to the patient, you try to say what he has already said. Clarification. There are many a time, especially in the psychiatric settings or in mental hospitals, that a nurse cannot understand what the patient is saying. He or she might find it difficult for the patient what the patient is saying. In those cases, we need to clarify, clear karu. We need to clarify what the patient is saying. I put in examples, so I found it tough to understand what you are saying. Can you clarify or elaborate your point? Say for example, the patient is trying to explain the relationship between he and his spouse. And we cannot understand the dynamics of this relationship because most of the time a husband-wife relationship is ununderstandable. So in those cases, we need to elaborate on what sort of feelings he has or what sort of relationship he is trying to elaborate. Reflection. Reflection would always be on a topic of the past. We are trying to reflect on a certain relationship. We are trying to reflect on a certain incident. It may be an episode of mania for a patient, and we are trying to ask him, sir, you were behaving a bit aggressively yesterday. Can you tell me what sort of feelings you had at that time? That's reflecting on a certain anecdote that had occurred maybe last night. I put in an example here. Can you describe the reason you fight with your mother? So that's something of the past, an issue of the past that you're trying to reflect upon. Next is humor. A very, very important component of any sort of a communication, whether you are on a one-to-one basis or you are in a mass. Humor actually acts as an icebreaker. Anyone here who knows what is an icebreaker? An icebreaker is an introduction, a start to a conversation, trying to make yourself familiar to the audience. See, for example, when I came here, most of you don't know me. So I use humor as an icebreaker, trying to focus on a relationship with you, try to build a relationship with you, try to build a connect with you. Similarly, when you are with the patient, you're going for the first time to interact with the patient, it would be nice to start with a joke, to start with humor. Or maybe when the situation is becoming too serious, you're talking about, the relationship of the patient with his mother. It's a very serious topic. So you need to lighten the mood at that time. You need to lighten the atmosphere at that time. I remember maybe 7-8 years ago when Himanshu sir had visited Charusat, he was enacting a role play, and most of the role play included humor. I'm sure that's the same in GIPS as well. So yeah, humor is a very important component of therapeutic communication. Informing, I think we are all very good at this. We inform the patient a lot of things. In fact, even the patient and the relatives. So when we want to inform the relatives, or we want to inform the patient about certain things, let's say for taking adequate water during the day, we need to inform him. And there is a lot of information that we can give. Since we are nurses, we are technically more sound than the patients. There's a lot of give of information. Okay, we have 12 techniques. I have focused upon 7, I guess. So the next 5 I'm going to focus upon right now. Focusing, as I said, I think we should talk more about the frequent repeat episodes that we have. Here we are trying to focus upon a certain pain point that the patient has. There are always pain points of certain patients. For example, probably most of us have a pain point here, which is digital addiction. And our mothers are very good at focusing on it. Right? Our mothers usually pinpoint, she focuses. Our mothers are very good communicators, by the way. Right? Yeah. The next is sharing perception. I know that most of you have come here sacrificing your Sunday. I'm sure most of you are happy sharing a perception. If the answer is no, then I'm not sharing the right perception. Anyway, so we can ask the patient, or we can sort of, communicate to the patient that I share your perception. I know your feelings, right? I've been in that place. I try to put myself into the shoes of the patient, trying to tell him, you look tired. Can we make this conversation some other day? Or maybe in the evening, you can take rest in the afternoon. So this is sharing his or her perceptions. Trying to understand what he or she is feeling at that particular moment. Theme identification. In the morning, Mr. Mohsin focused on the theme of the conference. What we are going to focus upon. We are going to break barriers today. We are going to empower nurses. Similarly, in a conversation with the patient, what would be our theme for that particular day? As psychologists, as nurses, and as psychiatrists, I'm sure that in every session, we have some short-term goals and long-term goals which we are going to focus upon. Say, for example, our long-term goal is going to be, or rather our short-term goal is trying to find out if the patient shares a good relationship with his friend. Right? So we might talk to the patient and say, we're going to talk about your friend Rohan today. How is your relationship with him? So that is theme identification. You're going to identify the theme for that particular conversation, for that particular window that you are going to interact with the patient. One of the most important things in a conversation is being silent. There would be moments when the patient would be sharing explosive news with you. Say, for example, the patient shares with you for the first time that I have been suffering from cancer for the past 2 years. It's explosive news. Difficult for you to digest, difficult for the moment for yourself to react in a particular way. The best possible reaction at that particular moment of time would be silence. The important thing in silence is not also removing your eyes with the patient, maintaining the eye contact. While maintaining eye contact, it means you are serious. You understand the patient, you are trying to understand him. You will also get a lot of non-verbal cues from the patient while maintaining eye contact with him. So therefore, while being silent, it's good to have eye contact with the patient. The last technique is suggesting the patient something. We are again સારખી સૂચનાઓ આપણે સૂચનાઓ આપતા બહુ આવડે છે એટલે suggesting the patient something useful. Say, for example, a patient who is old, say a dementic patient who is 80 years old, who cannot remember to take medications. You might suggest him. So it would be very nice if you put a reminder on your phone. It would remind you to take medications. So just suggesting patient, giving him good suggestions. So these are the 12 techniques that I focused upon in this particular small window that I had. Listening, broad opening, restating, clarification, reflection, humor, informing, focusing, sharing perceptions, theme identification, silence, and suggesting. Now, these are the do's of therapeutic communication. This is what you must do. I'm sure most of you are using these techniques in your daily life, and also with the patient, of course. But what are you not supposed to do? No, most people in this world would tell you what to do, but what not to do is also as important as what to do. So we are going to focus upon what you should not do while interacting with the patient and making conversation with the patient. First of all, failure to listen. There are a lot of times we as nurses are trying to do something, trying to clean the area of the patient, trying to clean the drawer of the patient, and also interacting with the patient at the same time. That's a don't. Yeah, you fail to listen to important aspects that the patient has to say during that time. So it is very essential that you have your full ears, you have your both the ears inclined to the patient, and you don't fail to listen to the patient. Conflicting and non-verbal messages. Sometimes you don't maintain eye contact. Yeah, that's a non-verbal cue that you are not interested in the conversation. Sometimes you have postures which make you feel that you are not interested in the conversation. A close posture makes you feel that you're not interested in the conversation. And that is very important to maintain an open posture while you are having a conversation with the patient. A judgmental attitude, sometimes the patient has secrets which involve a lot of judgments. As nurses, we are supposed to keep a non-judgmental attitude. Language barriers, sometimes or many a time, we try to show off our language, and the patient does not understand any of it. It's very essential. Sometimes in countries like France, Spain, these are all European countries, but they don't understand English. Probably most of you will travel abroad in the next few years. Remember that the patient needs to understand or have a conversation in his own language. False reassurances, this is again something which we do quite often. Give false reassurances to the patient that you will feel well, you will get all right. Give him an iron or folic acid tablet and tell him, this is a placebo. You will feel well after this. These are false reassurances, by the way, it should not be done. Giving advice, again something which our mothers are very good at. We are also good at giving advice, which should not be done actually. Criticism, constructive criticism might be good, but saying it to a mentally ill patient, it would be better if you could say it in a very positive manner. Trying to convert it in a positive term and using it rather than criticizing him on his face. So again, something which should not be done. And the last important thing that should not be done is rejecting information. Something which should not be done. It could be. Yeah. So trying to understand the patient and what he's saying is very essential, and not rejecting any sort of information that has been given. So here I come to the end of my topic. What I've dealt with is giving you a slight idea on what therapeutic communication is, trying to teach you or discussing the few techniques of therapeutic communication, and then also trying to let you know what should you not be doing while interacting with the patient. I'm open to any sort of questions or any comments on this particular discourse. Thank you. I'll be very happy if I have comments or questions, because only then would I know the quality of the lecture that I just gave. Yes, sir. Please.
Thank you, sir. Thank you. Very flattered. Thank you.
Yeah, any questions? That was a very nice sleep then.